How does malabsorption impact your vitamin D levels? Imagine trying to fill a bucket with a hole in the bottom. No matter how much water you pour in, it keeps leaking out. That's similar to what happens in malabsorption. When your intestines can't absorb nutrients properly, it affects many vitamins and minerals, including vitamin D, since vitamin D is mainly absorbed in the small intestine. Any damage or inflammation there can cause problems. Conditions like irritable bowel syndrome and colitis can inflame or damage the gut lining, making it harder for your body to take in vitamin D from food and supplements. When vitamin D absorption drops, your blood levels of this vitamin decrease. Vitamin D is essential because it helps your body absorb calcium and phosphorus, which are vital for strong bones. If vitamin D levels are low, calcium absorption also drops. This can lead to low blood calcium levels, known as hypocalcemia. When calcium levels fall, your body pulls calcium from your bones to keep blood levels stable. Over time, this weakens your bones and increases the risk of fractures and bone pain. People with sensitive stomachs, irritable bowel syndrome, or colitis often experience inflammation and damage in their gut lining. This damage makes it harder for nutrients like vitamin D to get into your bloodstream. Diarrhea, which is common with these conditions, can also wash away nutrients before they are absorbed. Some medications used to treat gut issues can interfere with how your body processes vitamin D, making deficiency even more likely. Because vitamin D deficiency is common in those with malabsorption, regular testing of blood levels is important. If levels are low, supplements may be needed. But since the gut may not absorb oral supplements well, higher doses or different forms of vitamin D might be recommended. Sometimes, vitamin D in the form of injections or other delivery methods can be more effective. To support gut health and improve absorption, addressing inflammation and healing the intestinal lining is key. Sun exposure also helps because your skin can produce vitamin D when exposed to sunlight, which can partly compensate for poor absorption. In summary, malabsorption from conditions like irritable bowel syndrome and colitis reduces vitamin D absorption. This can lead to deficiency, affecting your bones and muscles. Managing gut health and keeping an eye on vitamin D levels are essential steps to prevent related health issues.